Body is built from the smallest functional units, cells, which organize into tissues, organs, and ultimately systems. Understanding this hierarchical structure is vital for nurses, as many clinical signs and interventions relate to cellular and tissue-level changes. For example, when a patient has a pressure injury, the breakdown begins at the cellular level due to prolonged pressure-reducing blood supply. Cells perform numerous roles. Epithelial cells are flat cube-shaped cells packed together like a mosaic that line and protect surfaces. Muscle cells are long, thin fibers bulked together like a rope, which facilitate movement. Finally, nerve cells are star-shaped and reach out to each other like branches in order to conduct electrical impulses. These cells group into tissues such as epithelial, connective, muscle, and nervous tissue. Each plays a unique role in maintaining homeostasis. Damage to any of these cells and tissues affects function, often leading to observable signs like swelling, redness, or loss of mobility. As tissues form organs such as the lungs, heart, and kidneys, nurses must appreciate how organ dysfunction can impact the body holistically. An example of this is damage to nephron structures in the kidney, which will affect how well the body can filter waste and maintain an electrolyte balance. This in turn can lead to abnormal blood pressure or confusion, which are both symptoms a nurse needs to monitor. Being aware of these potential symptoms might prompt the nurse to assess the patient's vital signs more often, potentially identifying signs of deterioration sooner. In a similar way, body systems like the heart, which we refer to as the cardiovascular system, or the lungs, which we call the respiratory system, rely on every cell in the body getting enough oxygen and nutrients. If there isn't enough oxygen, cells can't work properly, which will cause bigger problems for the whole system. By understanding these connections, nurses can recognize early warning signs like hypoxia or dehydration and respond appropriately. Nursing care often focuses on restoring system-level balance, but the root of many issues is cellular. By understanding the progression from cells to systems, nurses can assess conditions more thoroughly and advocate for timely interventions.